This segment of Delmarva Live is brought to you by Delmarva Dental Services.
Well, I'm sure you've heard the saying, it takes a village to raise a child, but that village is a lot more than just people. There are often tools that can help raise our children, and two of them that a lot of kids and parents, for that matter, can't do without are the pacifier and the sippy cup. But have you ever wondered if either of those can be having an impact on your child's mouth? Well, joining us today to tell us more about that are Doctors Joe HARMON and Robert ESHAM with Delmarva Dental Services in Salisbury. Thank you so much for joining us.
Thanks, Jimmy, for having us.
Dr. Harmon, let me ask you this about the pacifier, the binky. Everybody thinks it has so much of a soothing quality. Does it really?
Well, it does. And in fact, studies have shown that it will actually reduce pain, minor pain. It's used for that.
Okay.
And it's also used to help prevent a child from putting their fingers or their thumb in their mouth.
Okay.
And it reduces hospital stays, the length of a hospital stays in infants.
So it's not just physical, it's
Psychological.
It's psychological as well.
Yes.
And there really is a good effect from this. So sounds like a good thing to do. But there are disadvantages as well, Dr. ESHAM?
Let me just add to that one. Speech pathologists and speech therapists who in turn have children, they're bound and determined to not use a pacifier. I think vast studies have shown that they end up using pacifiers just for their own peace of mind and et cetera.
Okay, so when it comes to
but go ahead.
When it comes to our child's development, their mouth, their face, their entire face, can this be a problem?
Most definitely, but that's only really after they're 2 years of age.
Okay.
And previous to that is reference to their facial development, as you expressed. No, there is no real long-term problem with that.
Okay, so you've brought different pacifiers here, and they look different to me. Why the different shapes?
This particular one is basically used in hospitals for preemies, and it has been studied over and over, but basically what it amounts to is that the child or infant will leave the hospital earlier using a pacifier than not.
Wow.
But there are no reasons, in reference to weight gain or any in that order, or oxygen levels, etc.
But you got different shapes here. Is there one in particular I should go with?
And then in turn, I'm sure, well, most of us have heard the orthodontic pacifier is the better one in reference to keeping the oral shape as it should be.
Right.
Basically, there are many studies, again, that indicate that there is no difference in the results as long as the child stops around the age of 2 years.
So personal preference, just make sure you're timing. What about the sippy cup?
Okay. The sippy cup is basically the only value that it has is, of course, is saving your carpets and your furniture and et cetera in reference to the spills.
Okay.
But from the standpoint, it is a transition piece or a training piece for the infant to go from the breastfeeding or bottle feeding to the straw cup. That's what this one here.
Okay.
And basically it's just like a pacifier. This sippy cup, it makes the tongue go down or below.
Okay.
And so from that standpoint, inherently, when the child swallows, the tongue is going forced out. And you do not want that as a long-term process. That creates a habit called tongue thrusting. That in turn basically makes the face skinnier.
Okay. So
Cross bites, overjet, those types of terms.
So the pacifier not past the age of 2. What about the sippy cup?
The sippy cup should be used only for a month.
For a month?
For the period of time when the infant has stopped breastfeeding or bottle feeding, to the point that in turn they can handle the straw cup.
Okay. So is there a certain time we should start using the pacifier,
Okay. Should start using the pacifier basically after a month of breastfeeding or bottle feeding.
Okay.
The indicated for using it that fashion is to allow, again, the baby and mom to get used to the breastfeeding or bottle feeding.
Right.
Then in turn, after that, to use it for about 6 months. and then in turn start weeding the individual away, or weaning, I guess, or what is the right word?
And weeding them off of that
Weeding them off, yeah.
and moving on.
Yeah.
Dr. Harmon, Dr. ESHAM, thank you so much for coming in this afternoon.
You're welcome.
Some great
Thank you.
information.
Thank you.
We're glad we came to you for that. Now, if you'd like to read more about Delmarva Dental Services, all you have to do is go to WBOC.com, click on our picture at the top of the page. Okay, there you go, our kids' health. Now let's talk about your health. How much time do you spend a day looking down at a smartphone, a tablet, an e-reader? Well, here's a follow-up question for you. Have you got aches and pains in your neck and shoulders? Well, the two might be related. We're going to explain why next. A little bit later on, those devices come in handy to remind us of what we need to do and when. But why are we so forgetful in the first place? We're going to find out, plus some helpful ways to boost your memory. Delmarva Life will be right back.